All right, welcome back, everybody. Our next guests are partners from One Accord Health and Ad Vault Incorporated. They joined the show to speak about the importance of providing improved palliative care for our families dealing with terminally ill patients. So please welcome to the show James Farnum and Lolita Melhado. Welcome, welcome, welcome.
Thank
Glad to be
you.
here.
Now, there are a number of things happening here. Um, Tell us, first of all, what is palliative care?
So, palliative care is really whole person care. It means treating the whole patient and family. Palliative care is really mind, body, and spirit.
There you go. And some people think that it's just that one person in their home and they're taking care of them, but you're taking care of not just that person, but everybody in the family. How does that look? How do we do that?
Yeah, well, when a person has a serious illness, there's also a lot of stress
Yes.
associated with that illness. And so the family who's caring for the patient is also very stressed and having maybe some anxiety, some emotional needs. So palliative care really treats the person and the family by meeting them where they're at, whether it's their spiritual needs or their psychological needs or their physical needs. Palliative care supports the patient and family.
Yeah. James, who determines whether somebody needs palliative care? Is it the healthcare company or is it the family? Or
You
both?
know, yeah, most people think that when you have a serious illness that um, you get palliative care when curative intent is no longer possible. But we believe that palliative care is introduced when you're first diagnosed with a serious illness, and it walks side by side with the curative intent. As Lolita said, we're really focused on treating the mind, body, and spirit of the person and their families.
Now, we off mic, we were talking about the difference between palliative care and what's the other one?
Hospice.
Hospice.
Hospice. What is the difference? Because some people think that at hospice, that's the end of the line. What? Yeah,
Well, hospice is end of life care,
end of life
and you
care.
need to have a diagnosis. You need to have a terminal diagnosis of 6 months or less to live. So, our former president, Jimmy Carter, is currently under hospice care because he's got a terminal diagnosis where the doctors have certified that he has 6 months or less to live.
Yeah, and some people go on living longer than that.
Exactly, because, again, for so long, hospice and palliative care was together. Palliative care is the part that treats the whole person and family.
Yeah,
So when they're getting the palliative care and the extra services, sometimes a person can thrive and their condition may not necessarily be at end of life right now.
yeah. James, talk about this new partnership with AdVault, and how can this help people during these sensitive times?
Yeah, that's a really good question. Dr. Bob, if I see another person with a GoFundMe page for a funeral, I think I'm gonna choke myself. The reality is that we all know that we're gonna die at some point. We just don't know when. The most loving thing that we can do is let our personal wishes known to our loved ones. And that's gonna alleviate end of life decision-making burdens. Um, so what we realize is that people, when we have conversations with folks about end of life planning, they believe that this is an important topic, but it's just not a priority. So
Yeah.
what we've done is we've put together a facilitated virtual advanced care planning process to help the individual and families document their wishes so that everyone knows they can identify a healthcare surrogate, they can really document their wishes for end of life.
Yeah.
What AdVault, and this is a great partnership, they had the digital component, the digital
Ah.
platform that
Yeah.
allows to develop and document these wishes, store them, and then share them with stakeholders. And then through interoperability, make sure that that document shows up when it matters most. So if they're incapacitated, for example, and they show up in the ER room, the ER department can download their wishes, and
Yeah,
everyone will know exactly what their end of life plans are.
yeah. And you know, a lot of people, they don't do advanced care planning. What do you tell our audience about that? What do they need to know about that? How important is it?
Well, I would say that it's very important, and as Jim said, it's we plan for weddings and birthdays, but we don't necessarily plan for end of life. And I've seen in the hospital setting where patients and families are not even aware of their illness or their diagnosis. And so I would say plan now, or so that you don't have to try to figure out what your loved one wants later on. And it's just a simple conversation as having, um, you know, what kind of care do you want? What matters most to you? And understanding what the person's values are, you're much better able to align them with the type of care that's available. Because oftentimes people think that, you know, I want everything done, when in fact everything has been done. And now the most loving thing we can do is just provide you with that palliative care so that we can support you through that journey.
Yeah, make people comfortable. Jim, who do people talk to about making these critical decisions? Is it that healthcare company? I'm coming back to it again because a lot of families do not want to delve into those conversations. Even talking about where am I going to be buried and things of that nature. It's just like, I don't want to talk about that right now.
So there's a couple folks that they can talk to. One would be their nurse, the healthcare professional. Those are the ones that typically kick off the advanced care planning process. But even with this platform, it allows us to document what they don't want as well as what they do want, which would begin to talk about end of life planning, burial services, estate planning, and that sort of thing.
Yeah, yeah. Wow. This is deep. I know we need to spend more time on this, but you guys have to come back and do it again, okay? We need, I think we need about an hour for this.
Okay.
But
We'd love to.
anything that we missed here that you would like the public to know? Because that's what this platform is for that. You come on, it's whatever you want the public to know about what you're doing.
Yeah, I'll take a stab. I think it's important to know that there are companies like One Accord Health and others that are really singly focused on making sure that that our community in particular get these services that they need, especially, and we're focused on end of life planning and advanced care planning, palliative care. But it's important to make this a priority so that, again, at end of life, we're not scrambling trying to figure out what your wishes are, and then you can elicit the family members and just really carrying out what your wishes
Yeah.
are as opposed to trying to figure them out.
Lolita?
Yeah, I definitely echo what Jim has said there. And, I think that this is also another way to bring health equity to people that maybe are not exposed to palliative care or advanced care planning. And I think that one of the things that our platform does is, because it's a facilitated process, it allows us to walk through that entire process with the patient or with their family members. So, yeah.
Where can people to go to find more information about AdVault and One Accord Health? Put us in one accord.
Yeah, you can go to any one of our platforms. Our website is www.oneaccordhealth.com, and you can check us out on social media as well, Instagram and LinkedIn.
One Accord Health, Palliative Care in the Bronx. James Farnum and Lolita Melhado. Thank you so much.
Thank you.
All right. All right, we'll take a quick break right here. We've got a whole lot more. Keep it right here. Kick off your shoes if you don't have them off already and relax your feet. I'm the Dr. Bob Lee. You're watching Open.